Imagine you're out for a walk, enjoying the fresh air, the sounds of nature, and the beauty of the outdoors. Maybe you're with friends, family, or just taking some time for yourself. The world feels peaceful and you're soaking in every moment. But then, out of nowhere, a snake appears right in your path. Your heart races. What do? This is a situation that can happen to anyone, anywhere, especially in rural or natural areas. It's a scary thought, but here's the truth. Every year, millions of people around the world are bitten by snakes. In fact, the World Health Organization estimates that up to 5.4 million snake bites occur annually, resulting in up to 2.7 million cases of envenoming. Tragically, over 100,000 people die, and many more are left with permanent injuries or disabilities. But here's the good news. Knowing what to do before, during, and after a snake bite can literally save your life or the life of someone you love. So let's break it down, step by step. First up, prevention. When I'm hiking or exploring, I always make sure to wear sturdy boots and long pants, especially in areas known for snakes. Tucking your pants into your socks or wearing gaiters adds an extra layer of protection. Avoid sandals or open shoes which leave your feet exposed. Stick to clear, well-marked trails whenever possible. Avoid wandering into tall grass, thick underbrush, or piles of rocks and wood. These are prime hiding spots for snakes. If you must go off trail, move slowly and watch where you step. If you need to step over a log, rock, or fallen tree, use a stick to check the other side first. Snakes often rest in the shade or under cover, and startling one can lead to a bite. And here's a big one, never pick up a snake even if it looks dead. Some species can still bite when they're not moving, and young snakes can be just as dangerous as adults. Teach children to respect wildlife and keep their distance. Snakes are masters of camouflage, blending right in with leaves, dirt, and rocks. Even experienced hikers can miss them, so always stay alert and scan your surroundings. If you see a snake, stop and give it plenty of space. Most snakes will move away if they feel threatened, but don't try to chase or provoke them. Respect their space and they'll usually respect yours. Most snakes don't want trouble, they just want to be left alone. If you give them a chance, they'll usually slither away without incident. But let's say the worst happens, and you, or someone you're with, gets bitten. It's a frightening moment, but your actions in the next few minutes are critical. How do you know it's a snake bite? Usually you'll see 2 puncture marks, but sometimes it's less obvious. There may be just a single mark, a scratch, or even no visible wound at all. Always treat any unexplained bite or sting seriously, especially in snake country. Look for sudden pain or burning at the site, swelling, redness, or even bruising. These symptoms can develop quickly, sometimes within minutes. In some cases, the area may become numb or tingly. If it's a venomous bite, you might also feel dizzy, nauseous, or have trouble breathing. Other symptoms can include blurred vision, sweating, rapid heartbeat, or even fainting. In severe cases, muscle weakness or paralysis can occur. Now, not all snakes are venomous, but you can't always tell by looking. Some non-venomous snakes mimic the appearance of dangerous species as a defense mechanism. When in doubt, always treat the bite as potentially serious. Venomous snakes often have triangular heads, slit-like pupils, and thick bodies like rattlesnakes, vipers, and some cobras. But don't take chances. Treat every bite as serious and seek help immediately. Here's what you do if you're bitten. First, stay calm. Panic only speeds up the spread of venom through your bloodstream. Take slow, deep breaths and focus on what needs to be done. Sit down and limit your movement as much as possible. The less you move, the slower the venom will spread. If you're with others, have them help you stay still and comfortable. Move away from the snake. Don't try to catch it or kill it. This only increases your risk of another bite and wastes precious time. Instead, make a mental note of its color, size, and markings if you can do so safely. Keep the bitten limb still and at or below heart level. This helps slow the spread of venom. If possible, use a splint or sling to immobilize the area, but don't make it too tight. If you can, gently wash the area with soap and water to reduce the risk of infection. Don't scrub or apply ice, and don't use alcohol or chemicals on the wound. Call emergency services right away, or get to the nearest hospital as fast as possible. If you're in a remote area, use a whistle, signal mirror, or phone to call for help. Time is critical. Antivenom works best when given early. And if it's safe, remember what the snake looked like, or snap a photo. This helps doctors pick the right treatment, but never risk another bite just to get a picture. Whatever you do, don't try old-school tricks like sucking out the venom, cutting the wound, or using a tourniquet. These methods don't work, and can actually make things worse by causing more tissue damage or infection. Snake bites are serious, but with quick action and proper medical care, most people recover fully. Antivenom is highly effective when given in time, and supportive care can prevent complications. I always try to learn about the snakes in my area and keep a basic first aid kit handy. Knowing which species are common where you live or travel can help you stay alert and prepared. Consider taking a first aid course focused on outdoor emergencies. And if you found this info helpful, share it with your friends and family. You never know whose life it might save. Encourage your community to learn about snake safety and be prepared for emergencies. Remember, know the risks, act fast, and you can save a life. Preparation and awareness are your best